Hello, I'm Dr. Shauna and I'm with the Dr. Low Surgery Clinic. Today I'll be talking about fillers, and firstly we'll start off by sharing my personal choice of fillers. So there's so many different types of fillers out there in the market, and I think different doctors practice differently. My personal preference is to use hyaluronic acid fillers. This is in contrast to other types of fillers like biostimulators or collagen stimulators. And this is because hyaluronic acid fillers are easily dissolvable with an enzyme called hyaluronidase, and that's easily available for us to inject if, let's say, you don't like how it looks or if we run into certain issues during the injection process. And it's definitely a safer option compared to the rest. So why do we need fillers, or why do people do fillers? I think it's easy to split them into three main parts. So the first reason why fillers are useful is that it's good for lifting purposes. In ladies or men who are looking to make their face a little bit more firm or a bit more snatched, fillers are definitely a good option. How they lift your face is basically when they're placed in the outer one-third of your face and in the right layers, it can actually give you a tighter appearance by lifting any sagging skin or soft tissue upwards and outwards. The second big group is definitely what is most commonly known for, volumization. So especially when we age, certain fat pads or areas in our face actually lose fat. And we really need to replace volume, and fillers are an excellent option for that. By doing so, it gives you a youthful appearance and avoids having a hollowed out look. The third one will be for midline or central projection. These are areas like your lips or your nose where you want a little bit more definition, and this is actually quite common, especially in Southeast Asian faces, just because we may not have as defined facial features compared to our Caucasian counterparts. So when it comes to the process and how it works once you come into the clinic, so we always start out with a consultation and assessment process where I'll have a good chat with you about your goals and what you want to work on. So I think when you come into the clinic, many people have certain areas that they want to work on. For example, they come in saying they want to work on their laugh lines or their under eyes. But I always put in the effort to use what I learned in my MD Codes practice, which is to really understand what are some areas of expression that you want to work on. For instance, do you want to look less tired? Do you want to look less unhappy? Or you want to look less aged? These are certain things that we can work on and identify these points before letting you know what you actually need as opposed to what you want. So that's always the first step of our assessment process. And then we move on to take some clinical photographs so that we can assess you from different points in time. Next, we'll move on to give you some analgesia. This is with some numbing cream. And after about 15 to 20 minutes, we'll get started with the procedure itself. Firstly, I'll make some markings over the areas of injection, and then we'll get started with the injection process, after which we'll give you a little bit of antibiotic cream and also give you some post-procedural care. With regards to post-procedural care, it's important to avoid alcohol and exercise for about 24 hours, and thereafter you can continue your regular activities. I would also advise against using any harsh active ingredients in your skincare immediately after the injection process, just because your skin might still be a little bit inflamed or easily irritated. So now we come to another part that I get a lot of questions on, which are what are the risks of filler treatments? So we can start with the more common risks. Sometimes you can have a bit of bruising and bleeding immediately after the procedure. That can be quite common. Sometimes you can get a little bit of redness over the areas of injection, as well as some mild swelling immediately after. This is because the hyaluronic acid within the fillers actually draws water into itself, and therefore it's quite common to have a little bit of swelling in maybe about 1 to 2 days immediately after the procedure, and thereafter it will come down and you would have much better results after that. Of course, we do have a bit more scarier risks, things like vascular-related risks. What this means is that sometimes you hear of things like blindness or areas of the skin that may become damaged or not viable anymore after the filler injections. And this is because sometimes the fillers can occlude the blood vessels or block the blood vessels. This can be with many different ways. Sometimes it can directly go into the blood vessel and block it, or sometimes it can be from external pressure outside that causes blood flow to be reduced. Of course, with the right techniques and the right precautions, a lot of these risks can be minimized, but sometimes these still happen. And that's why with hyaluronic acid fillers, it's a lot safer as compared to the other options, just because we do have enzymes available that can dissolve the fillers to mitigate these risks. We hope this helps you to learn a little bit more about how fillers work in aesthetics medicine. And if you'd like to find out more, feel free to find us on our website or come down to our clinic for a quick consultation.